Good morning. Today is Wednesday. It is the 2nd of November, 2022, and today is the mental side of physical. Now I'll stop so I don't create it. And it's cat. My shirt is cats. Don't need names. We know who we are. This is my thumbnail portrait. Okay, so ignore all that. Anyway, it's a good shirt to segue in today. How we name things, how we put tags on things, how we think we know mentally what's going on. So I've been reading a lot about the brain, and how the brain forms strikes me as very physical, right? But we're talking about the formation of an organ that we think of as mental. And like I've said, I don't think you can separate out the two. I think we do. I think we try to part it up, name it. That's your job, that's your job, that's your job. Turns out it's very intertwined, very complicated, like much of life. I think the takeaway for me from reading about how the brain is laid down and how it evolved is that our cognitive brains, our thinking brains, are the youngest part of our brain. We're neophytes, we're babies, we're children acting like adults in a world that we're just beginning to understand. 30% of your brain is involved in the outside world, kind of looking around, figuring what's going on, figuring about how you fit into that, how you're thinking, the thinking part of your day, which I don't know about you, but feels like the all day part to me. 70% of your brain, the lower parts of the brain and the brainstem, they're old. They're emotional, they're primitive. And when I think about that, that makes sense too. Because I think, what? Are most of the people around me cognitive? No, they're emotional. And you deal with that all day. For me, I've often said the hardest part of my job is not the cognitive part of my job. I know what I'm supposed to be doing. It's dealing with all the drama, emotional stuff. I think this is really interesting too. The neocortex, it's pretty much fundamentally in place. Not that it's not elastic, it doesn't respond, because remember, the brain is cultural. It's shaped by experience, and I absolutely agree with that. But those early years are so important. So important. 7, that's called the age of reason. If you would have asked me what's the age of reason prior to my latest deep dive, I would have said probably 20s, 30s. Now, I think that that's when we're kind of building our house on the foundation, but that foundation is pretty much in place. Wow. Now, I didn't grow up with kids. I made a decision very early on not to have children. I thought, I'm in no way equipped. I don't come from parents, I come from accomplished parents, but I don't come from parents who were particularly good at raising children. So that's very interesting to me. As I watch children in my practice every day, I watch their interactions with their parents. I also read, and I love this, because I think it's a key component in how underestimated trauma is, and how it doesn't have to be a child who ends up in the NICU or the PICU because of actual physical abuse. Trauma almost invariably is from not being seen, not being mirrored. There are these things called mirrored neurons, which I had never read about until I read Vanderpolk's book, The Body Keeps the Score. So again, almost invariably is from not being seen, not being mirrored, not being taken into account. I have said many times, today is Cognitive Therapy Day, Wednesday, to my therapist, that I felt invisible. I didn't feel like I mattered. And I didn't suffer, and this has always been kind of a way that I've maybe adjudicated my childhood, because it's worse. There are way worse things out there. I don't know about that anymore. But anyway, I do think that that's an important fundamental component, no matter how the abuse occurs, is children do not feel seen. What's the being heard, not seen, or not seen, not heard? I'll have to look up that quote. But Robert Onda, he worked for the CDC for a long time, did a lot with this thing called the ACE test. First time I read about the ACE test was in What Happened to You. But it's the Adverse Childhood Events. It's 10 questions. You can go online and take it. You can actually get involved in some wonderful organizations too, and I will link them as well. But basically, it's how your life is predicated on your childhood, and that just makes sense. But also, how we don't recognize it. How far we've come with PSTD, post-traumatic stress disorder. And we still have a long way to go. But childhood abuse, he maintains, and I agree, because I see it in everyday life, and I do not live in a community you would necessarily expect to see it in, although that's a great misunderstanding too. It's the gravest and most costly public health issue in the US. Hands down. I agree. The overall cost exceeds cancer, heart disease, and I love this word because I think it describes fundamentally childhood abuse. Insidious. We do not understand the cost of childhood abuse. Eradicating child abuse in America would decrease depression, cut it in half. It would decrease alcoholism by 2/3. Absolutely believe that. Suicide, IV drug use, and chronic violence by 3/4. Because think about this, the ACE test was not predicated on the socioeconomic class you would think that it was. And that all may be just some metric so we can wrap around or maybe justify our lives. But it's middle class to upper middle class white Americans. So if these statistics are so prevalent in that demographic, imagine, but maybe not, kind of like the ego. There's a great series on Gaia about transcending the biblical narrative. And these two people who are fundamentally involved in our world talk about India, talk about Africa. And you might look at those continents and you might look at the socioeconomic class. Yogananda Paramahansa said the same thing. Faith, belief, self-esteem are so much higher. Even though you may look at it from an economic perspective and say, this doesn't make sense. But when I think about that, and I think about the minimal interactions I've had, I would agree, because they fundamentally do a better job with the family unit. Very interesting stuff. One of the things that a lot of childhood trauma specialists, and I think a lot of us in general, struggle with is, why would you do this to another human being? Why would you do this to a child? I don't think anyone who has a child intends to hurt that child. If you have heard the saying, hurt people, say no more, right? So we take these skills or lack of, and we pass them down. I think most parents do the best they can with the skills they have. But when I look at what comes into the clinic I work in, just wowsy wows. And when I worked in a children's clinic in Texas, a huge one, apple tree, it felt like. See, the parents come in, man, that explained everything about that child. So, digging into your past, digging into your childhood may be painful, but I think it's worthwhile. It is the mental side of the physical the physical in which you were born and raised and learned to evaluate the world, whether you think it's safe or not safe. I'm going to leave you with a quote from chapter 6 of The Body Keeps Score, and I'm going to read it because it's beautiful. Be patient toward all that is unsolved in your heart, and try to live the questions themselves. Live the questions now. Perhaps you will gradually, without noticing it, live along some distant day into the answer. So I've talked about that before. Yep. We think the answer is everything. It's what we're working toward. But the question is the really important part. And starting to ask the questions, starting to be confused, starting to look at that mess, that's going to be your solution. So, as always, go gently in the world. Thank you for spending a little bit of time with me today, and I will see you back here tomorrow. Dahanabad.